Hello everyone, I'm Krishna Aryal. I'm from Nepal. My background is medicine and public health. I have been working in this area of healthcare delivery system in and around the health system for about 15 years now. Currently, I'm affiliated with the Bergen Center for Ethics and Priority Setting in Health at the University of Bergen. Here we work with low and middle income countries to help them with decision support, especially in terms of choosing what health services need to be included in a healthcare delivery system. We will be discussing and talking about universal health coverage today. Universal health coverage, in short called as UHC, was a target that was set in 2015 by World Health Organization when they set the target for Sustainable Development Goals. Universal health coverage, by its definition, means all people should get the access to essential health services, especially the vulnerable population, without being exposed to financial hardship. So by saying this, every people, if we take an example of a nation, within that nation should get access to essential healthcare services that they need anytime, anywhere, whenever they need. So the services should be available to them, and then when they are accessing that, they should not be suffering for any kind of financial hardship, or they should not be paying a huge amount of out-of-pocket cost to get access to the services. We just talked about what the target was set in 2015 and what it was meant to, or where the countries or the whole world had to reach by 2030 about universal health coverage. But now we are in 2025. Have we done enough? Have countries progressed enough in terms of progressing towards universal health coverage? By saying that, you mean covering all the population, all the people with essential healthcare services. It might not be the case. When we look into the report of the UHC Global Monitoring Report for 2023, which gives you the progress until 2021, it still shows that in 2021, about 4.5 billion people, that is more than half of the global population, were not fully covered by the essential healthcare services. Same time, the target for universal health coverage is also to protect people from financial hardship. But when we look at the progress of financial hardship, we see that more than 1 billion people experience a huge amount of large out-of-pocket payments, which is basically defined as exceeding 10% of a household budget, and it is said as catastrophic out-of-pocket health spending. In addition to that, there are people pushed further below the poverty line because they have to spend in the healthcare. And when we see the numbers, that's quite scary. In 2021, approximately 1.3 billion people were pushed to further into poverty because they had to spend for healthcare. The situation or the problem looks quite alarming. So how do we get back on track? Keeping in mind that we just have 5 more years to reach this target of universal health coverage by 2030. To reach the goal of universal health coverage, we need substantial public sector investment, and then we need to accelerate the action by all the governments, including the development partners, which is very much essential. And for that, the key radical reorientation of health systems is very much important towards a primary healthcare approach. For doing that, we need to make sure that the essential health services are designed in a way that is really cost effective and is what is needed for the country. So while talking about getting back on track, let's go back to this famous UHC Cube, which has 3 dimensions in it. One is the services, which services are to be covered, or what services are to be included in any healthcare delivery system or healthcare services list. So the second one is what population are we covering? How much of the population of a defined geography or a country are we covering? And the third one is how much cost we are reducing for people. That means how much cost sharing are we doing, and then how much fees are we reducing, so that we are protecting people from financial hardship. So looking at the services dimension, we need to select the services to be included with the available budget or a limited budget. Let's say we cannot afford to provide each and every services to the people of a country. In that case, we have to make some hard choices, and then that choice has to be done following a systematic process which we call as priority setting in health. So choosing the priorities, following a systematic process of priority setting in health will help us select the services that a country can afford and which is equally helpful to achieve the population health outcomes. So we have now seen the UHC Cube, the famous cube, where we talked about the different dimensions of the cube. When we said and talked about expanding the services, this is a tricky part where we need to decide on what services to be included in any essential healthcare package of a country. To do that, we need to follow a systematic process. We cannot simply choose certain set of services and include in any healthcare delivery system and aim of getting towards the UHC. But to choose those services, there is a process called priority setting in health, which actually helps any country or an authority to decide what services to be included. That is basically among the competing uses. We decide following a process on what services or interventions we want to include that will equally have maximum benefit with use of limited resources. By following this process of priority setting in health, we then help the government or any authority to decide the most cost-effective services that they can include in their package within the available budget. So we talked about universal health coverage, what it means, and the target that was set in 2015. And then in 2025, while looking at the progress, where have we reached, or have we made enough progress in terms of covering people with the essential health services or not? And we saw that the progress was not so satisfactory. And then we also talked about we could do something around priority setting in health to help define the services that needs to be included in any of the essential healthcare services list. By doing this, what countries can do is within the available budget that they have or a limited budget that they have, they can try to include as many services as possible that are really giving them benefits in terms of health outcomes, so that with low or less cost, they can get maximum benefit in terms of life and life saved.